Open the foil pouch, take out the test card and the disposable dropper. Put them on a flat and clean work surface. Pipette the sample with the provided dropper, then add 6 drops vertically and slowly into the sample hole S. Read the result at room temperature in 10 to 20 minutes. Results are invalid after more than 30 minutes. Interpret the results within the result window. If only the control line C appears, it indicates a negative result. If both the test line T and the control line C appear simultaneously, it indicates a positive result. Additionally, the higher the antigen titer, the darker the color of the test line T. If the control line C does not appear, the result might be considered invalid. We will use the classical swine fever virus antibody rapid test kit as an example to explain the significance of the intensity of the test line T color. When the color of the test T line appears darker than the color corresponding to a 1 to 32 titer on the antibody titration color card, it indicates that the antibody titer against classical swine fever is relatively high and has reached the protective level. When the color of the test T line appears lighter than the color corresponding to a 1 to 32 titer on the antibody titration color card, it indicates that the antibody titer against classical swine fever has not reached the protective level. Therefore, it is recommended to administer a vaccination booster.